Hi everybody, I hope you're still awake after 12,000 presentations. My name is Valentina Evangelisti, I'm a DRR lead in Oxfam. I am here to present you a work that we've done to quickly assess what's DRR added value when we are responding during a crisis. So what's the added value of DRR in reducing humanitarian needs? So we did work in 5 different countries in 2017. Between August and October 2017, the monsoon rains caused flood in India and in Bangladesh. In Assam, Uttar Pradesh and Bihar, we had programs also in Nifalmari, Gaibanda, and I changed that slide, but it didn't work. So in Shiranganj and Nifalmari department. And in September 2017 also, Hurricanes Irma and Maria hit the Caribbean in areas where we had also DRR programs ongoing in San Cristobal, Dominican Republic, Cap Haitien, Fort Liberté, Haiti, and the Guantanamo province in Cuba. So these are the floods in one of the India department where we were working on DRR. And hurricanes impact in the Caribbean. While we were responding, so we responded in the most affected areas, and while responding to the basic needs, we also realized that there was a huge opportunity there to understand better what was the added value of the work we did in DRR. We are used to have evaluations of those projects, but it's always in peacetime. At the end of a project, you do your evaluation and that's all. But it was really a real-time picture of how community could cope, prepare, cope, and recover in that moment. So we set the rapid impact assessment process. So we did several impact assessments in Asia. We used the pointer then. In Assam, we were working in several districts, but basically we picked a few to do a sample. So we were working in Jorhat, Golaghat, Lakhimpur, all this area, and also in Uttar Pradesh, in this area, close to Gorakhpur, Maharashganj, in Siddharnagar, and also in the western part of Bangladesh. So here. And in all these areas, and also in the Caribbean, in the area of Santo Domingo, San Cristobal, in the area of Port de Paix, Cap Haitien, and in the area of in the region of Guantanamo. All these programs were funded by different donors and had different focus. Some of them were DRR programs, some of those were more long-term resilience programs, but they had similar components. So the methodology we used was really basic, mainly qualitative. We did a focus group, disaggregated and also mixed. We did key informant interviews with institutions, with specific groups, with people with disabilities. And we also used a lot of information, literature and information from both the programs, but also the humanitarian response. This was key information about the needs that were registered during our humanitarian response. We also specifically asked in the focus group to people to define an event in the past where they had faced a disaster. How did they prepare? How did they respond? And how did they cope? And then the same to think about the present event and how did they prepare this time? How did they cope this time? So the guiding questions of the assessments were: has the DRR intervention increased the community's authorities' capacity to prepare, to anticipate and respond? Has the DRR intervention contributed to more effective response by communities, local NGOs and institutions? And has reduced the humanitarian needs of the communities that were affected by the flood or by the hurricane, different shocks in different countries? So the findings. All the findings are regrouped in different categories. It doesn't mean that all these components were present in all the programs. I've regrouped on category. But so all of them had the community preparedness component, but the other ones are not in every program. So where we had the community preparedness component, we saw that during the response, during humanitarian response of the community, means before humanitarian aid arrived from outside, they were able to better activate their early warning at the community level. They had safer and quicker evacuation. They had food during the few days before the aid came because they had stocks, because they were prepared. They had availability of basic first aid. They knew how to treat. This is a lady lying in, showing how to treat a snake bite, because during flood is very, very common, and all the other techniques. They have better access to information, and they also, in some areas, there was a reduced loss of lives compared to the areas where they didn't have DRR program, DRR activities before. So where there were livelihood components, for example, livelihood, it's very, very broad, so it could be focused in agriculture, so diversification of the crops, training for flood adaptive agriculture, or campaign to vaccinate the livestock. We saw that there was a reduced loss of livestock, reduced economic loss and belongings, a quicker livelihood recovery, and also, in some cases, an increased capacity to monitor the risks and the climate information in the agricultural sector. That was specific to Cuba, where there was a strong component of forecasting climate information accessible for farmers. Where there was a resilient WASH component, what do I mean by a resilient WASH component? It's mainly public health promotion, but also installation of latrines and other infrastructures that are resistant to the floods in the area where it's needed. There was access to safe water during the flood, as you see here. The water was safe to drink even during the flood. Safe dignified sanitation. And the reduction of the waterborne disease during the first day of the disaster. We also had some of the programs, most of them, that had a component that was focusing on linking the communities with the institutions to make them able to be the agent of the change and be able to advocate for the institution to take in charge disaster risk management. And so there was an increased capacity even during the crisis, the flood or the cyclone response, to mobilize themselves and to refer to those local authorities, and an increased connection and capacity to identify who were the duty holders, and an ability to plan in general on the long term, linking with the institutions. We also had in some cases, components of these programs that address the capacity development for local authorities and the disaster risk management agencies. So we saw that during the response, there was better monitoring and institutional early warning systems, knowledge and integration of protection principles in the response, and integration of people with disabilities. These two last things were really particularly clear in the Dominican Republic and in Cuba, because we supported the institution to create this knowledge, and this, in particular on the protection side in Dominican Republic, to have a specific commission, advisory commission, that would improve the state of the shelters during response. And also a gender-specific DRR component would then result in the response, an increased awareness and knowledge of women, of risk, and improved preparedness capacity, a really prominent role in the response, but also an increased self-confidence in general that allowed them to be really have a leadership role in their community beside the response and even after. Some of them were elected also in some local bodies. So of course there are also some limitations. The location and the timing of these studies is really, it's a really narrow window because it needs to happen in a location where we've worked DRR, where we're responding, where we have the information otherwise about the response, about the humanitarian needs that are there and how they change. It also is difficult to isolate the contribution to change. So what's Oxfam contribution to all those changes? Not just thanks to this program, but also are many other elements that intervene. So it needs to be improved. And it's pretty qualitative mainly. So the next steps for us are a methodological review that is ongoing to improve and integrate more quantitative data into these kind of studies. They still have to be quick and not long impact analysis. We do have those long studies that are based on, for example, for resilience on economic household analysis. But this is really a quick exercise, so it needs to stay very, very light. We look for other stakeholders that are interested for collaboration or they're doing similar exercise. I know a few of them, but if you want to talk about it and you have been doing DRR impact assessments, please come and talk to me after the presentation. And we look forward to systematize this exercise more and more in our responses. And also, I will finish with thanking all the local partners that we work with. We've been doing all these programs with more than 15 partners. I will not name all of them, and maybe you can have a look. In Bangladesh, there are 15 partners. In India, there are 12. We've worked with the civil protection in the Caribbean, in all the 3 countries. So it's really them who have done all the great work. If you would want to know a bit more about how we work with women in DRR and we address the specific needs and how they're affected by risk, you can go and see my colleague Chandan here, who has a nice toolkit. He will show you the cards that we use to work with them. So thank you very much. I think I have no time for questions. Okay, thank you.
Oh. One question, if that's okay?
I am Dr. Madhyadagan from India, Tamil Nadu. Yes. One question.
Yes.
What methodology you adapted to collect this information, data collection?
Sorry, I couldn't hear.
What methodology you adapted for this study?
What methodology? So the methodology was really, really qualitative and pretty basics. It was based on key informant interviews with institutions, with local partners that we've been in those areas, working there, and with members of the communities. Focus group discussions with institutions, with the communities, and with the partners, and in some cases of specific groups. For example, in Dominican Republic with the builders community because they were involved in specific activities, and also review of literature. But because it's really qualitative, we want to make a step forward and make it a bit more solid. So we're looking for ways to integrate quantitative data, maybe even pre-existing, to have this impact even more demonstrated more strongly. Because I think it's there, we all know about it. It is just a matter of demonstrating it and having solid information.
To validate the data, have you conducted triangulation? You conducted focus group.
Yeah.
Have you conducted triangulation?
Yes, of course. Triangulation, yes. Yes, definitely. That was the main check that we do. And also across the different documents that we had. So we had the need assessment, we had the baselines, so baselines from before, needs assessment from the humanitarian responses, and all the triangulated information from the discussions and the interviews.